We are proud to share that since the start, our organization, ASM Matrix Community, has successfully certified over 300 students. Sir, coach. Sir Kim and Ma'am Mary.
You don't have to wear it now.
Okay.
It's just skills. So, rescue breaths. So you provide cardio, pulmonary resuscitation. And that is the first aid that you provide to someone whose heart and lungs have stopped working. 30 compressions and 2 breaths, 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 then you reassess your patient. Take note, I did not say anything about reassessment in between the cycles. So you are supposed to do 5 cycles continuously until you reach that 5 cycles or 2 minutes of CPR, whichever comes first. As a general rule, for children and babies, if you are alone, provide 30 compressions, 2 breaths for 2 minutes. For team rescue, babies and children, perform 15 compressions, 2 breaths for 2 minutes. Okay? It has to be strong enough. Sir, are you okay? Wake up, sir. You can also do the sternal rub if you're used to that. You can also do this trapezius pinch. You can use that. What are we looking for? Of course, we want the victim to wake up and say, "What are you doing? I'm okay." So, at the very least, you need to see a blink of an eye, an arm, or a leg movement. Okay? If your victim does not respond, then you need to call for help. So again, inside the hospital, if that is a scenario that you want to practice, I need to hear code blue, get a crash card. If you want to practice, because you get to choose which scenario you want, if you want to practice the outside the hospital scenario, then I need to hear you say, dial 911, bring an AED. Then, check for pulse and breathing at the same time. For adults and children, take note of the Adam's apple. Also take note of the angle of the jaw. Start with 2 fingers at the Adam's apple, and then slide your fingers midway between the Adam's apple and the angle of the jaw. That's where you're going to get the carotid pulse for adults or children. For babies, it's the brachial pulse. Yes, you will get a pulse, you will feel for a pulse here, but most experts actually suggest that you check the pulse in the upper inner arm between the armpit and the elbow. Wake up. You would not see any blink of an eye, no arm, no leg movement. I'll sit him up and shake him up. Still, he would snore, but you do not see any blink of an eye, no arm, no leg movement. This person is dead. Start CPR. Okay? Got it? I need you to remember this one. Why? Because 40 to 60% of those who get sudden cardiac arrest present it this way. And a lot of you, same percentage, 40 to 60% of you guys do not recognize this one, so CPR is delayed and the patient dies. So I need you to remember this sign. Okay? Not responding. Sir, can you please call the nurse at the station? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No pulse, no breathing, starting compressions. Now once the nurse comes in or the intercom turns on, you tell her, code blue, get the crash card please. That's for inside the hospital scenario. But what about outside the hospital? For those who want to practice the outside the hospital scenario, look around. Grandma, she's not responding. Can dial 911 and tell them to bring an AED. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No pulse, no breathing, starting compressions. Okay? So, just look for the flat portion of the chest. That's where you put the heel of your hand. Try to push 2 inches deep on a child. If you cannot reach the 2-inch depth, you are allowed to go back to the 2-hand method. So for children, it is 1 or 2 hands. For adults, automatically use 2 hands. So heel of your hand, in line with the nose, stop at the lower half of the sternum. You can interlace, you can interlock, you can choose to cross, you can also choose to hold your wrist. All of these are considered 2 hands. So that will be up to you which one you're going to use. Again, you can use right hand first, left hand first, right side of the victim, left side of the victim. It's up to you. Then push straight down, okay? And then allow the chest to bounce back to its normal place. This is the step number, the element number 3. Allow it to bounce back to its normal position without your hand leaving the chest. So it still has to be in contact with the chest. Lean forward, make sure that your shoulders are above your head, keep your arms straight, elbows locked in place, and then again, push straight down. Then allow the chest to bounce back up. Okay, you have to allow the chest to bounce back up so that blood can go back to the heart to refill the heart. So that the next time you squeeze the chest, there will be blood circulating. And keep on doing these chest compressions until you reach the 30th compression and then hands off. Okay? So you have to allow the chest to bounce back so that blood can go back. Okay? Okay. And that's the reason why the song Staying Alive is popular with CPR, because that is around 100 to 120 beats per minute. Now, you can sing if you want, if you're doing the hands-only CPR. But if you are doing the cycles of CPR, then there is a count that is expected from you. So, if you are going to do the hands-only CPR and you don't have a watch with you, then just sing. But let's update your songs, okay? You can use Water by BTS. You can use You Are My Universe by Coldplay. You can use 22 by Taylor Swift. Bad Romance by Lady Gaga. Uptown Funk by Bruno Mars. Renee by Bruno Mars. So, you can use those songs as an update, or you can simply go midway, Baby Shark, Macarena, you can use those as well. Okay, but again, if you are doing cycles of CPR, then what is suggested is that you download a metronome. Metronome is an app used by musicians to set a certain beat. So we will set the metronome at 1 beat at 110 beats per minute, and you have a guide, okay? For babies, if you are alone, you have 2 options. Option number 1, 2 fingers. You can use your index and your middle supported by the thumb. You can start here and then move to the center until you are in line with the nose and push straight down. Allow the chest to bounce back up. And once you reach 30 compressions, hands off. Okay? Option number 2, you can use the 2 thumbs encircling the chest method. So 2 thumbs encircling the chest methods. Use the tips of your thumbs to feel for the baby's nipples. So just lift the baby up so you can see, but please do not do this in real life. Okay? So feel for the baby's nipples and then slide your fingers in the middle. As much as possible, keep your thumbs in the middle, because if they're way apart, there's a higher chance for the ribs to break. Sternum is very narrow, so as much as possible, keep your thumbs in the middle. Your fingers is not expected to reach the back. So it's not a requirement for your fingers to reach the back. It can stay on the sides, okay? So push and allow the chest to bounce back up. Now, even if the name of this method is two thumbs encircling, does not mean that it's just the thumbs moving. It has to be all fingers squeezing the chest. Okay? Not just the thumbs. This is called a BVM, bag valve mask, or bag mask device, or a resuscitation bag. Okay, not AMBU bag. AMBU is a brand name. It's the cheapest of the branded. And this one is Vortex. It's not AMBU. Okay, so anyways. And do not make your BVM fart. Okay? Why? If you hear the BVM fart when you are giving ventilations, that means there's so much pressure here that the valve needs to release the excess pressure here. And when there's so much pressure here, there's so much pressure here that you are going to force the air into the tummy instead of the lungs. The best visualization I can give you is to remember to give breaths the way you are breathing right now. Okay. 25, 26, 27, 28, 29, 30. That's how you give your breaths in real life. Do not give it because you do not breathe, right? So you give it the way you breathe, okay? So that's how you give it. Okay, so baby, are you okay? Baby, wake up. He's not responding. Sir, can you please dial 911 and give me bring me an AED. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No pulse, no breathing. Starting compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 30 because I'm alone. So 30 to 2. Over 1 second. Stop 1 second, give your second breath over 1 second, and then quickly go back to chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. And quickly follow it with 2 breaths over 1 second. Stop 1 second. 1 second, and continue until you reach 2 minutes of CPR or 5 cycles of CPR. Sir, wake up. Wake up. Sir, wake up. It's not responding. Sir, can you please dial 911? Get an AED for me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No pulse, no breathing. Starting compressions. Lean forward and then push straight out. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Tilt the head back as far as it will go and then squeeze. Over 1 second, stop for 1 second, give your second breath and quickly go back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. So we will require you 2 cycles of CPR. So wear your gloves, please. Please put on your gloves. We will ask you to go to the stations. There are 4 stations. You do not have to mention. Okay.
Okay, no response.
Hello, sir. Hello, are you okay?
Okay.
No response.
Help.
So, yeah, please call 911 and get me AED.
Okay, check for pulse.
So,
Okay. Carotid pulse, okay, for 10 seconds. Okay. No pulse, no breathing.
No pulse, no breathing. So, we'll start with the compression.
Okay.
In the nose line.
You must push hard and fast, okay? Count 1. Count. Okay, very good. Okay, give 2 breaths. Using the bag called mask. Okay, seat clamp, head tilt.
Head tilt.
Okay, back. Okay, you see the chest rise. See the chest rise. 2. Okay, very good. You see camera.
For 10 seconds we can check for brachial pulse. That's 1, 2, 3, 4, 5, 6.
This green light indicates it's moving correctly.
Have a green button, and they are using the universal icon, which is the same icon that you will see with the power buttons of your phones. Okay, look for that. Press it, and then wait for it to speak. It will say, apply pads to patient's bare chest. So AEDs are okay for any age, Place it near the head, and then bare chest means there shouldn't be anything between the chest of your victim and the patches. So, if it is not allowed in the country where you are in, lift the shirt up. If it's a female, cut the bra off. Place your patches where they need to go, and then lower the shirt. Okay? If it is allowed in the country where you are in, remove the shirt. If it's a female, cut away the bra, open the bra, and then apply your patches. Okay? Okay. Not see a razor, then get the extra patches. Place it where you need to use your patches, and then quickly rip it off. If your victim says ouch, he's alive. Okay. If you make sure that the drawing is facing you, and then the sticky part will go on the patient's skin. Follow the drawing. This drawing shows that you have to place this over the right shoulder, under the collarbone. If someone else is performing CPR, he will not stop CPR just for you. Find a way to stick this on the chest without him stopping CPR. You can place it this way, this way, this way. So any direction, as long as it is in the general area of the drawing. Get your other one. Take a look at the drawing. This one shows you that this should be placed over the left side, underneath the armpit, so mid-axillary line, usually at the level of the left boob. So you can place it this way again, or in any direction you want, as long as it is within the area that you see on the drawing. Remove the plastic backing, stick it there. Now, let's Press on both patches in the middle to try to expel the air. And once the machine detects the patient's skin, it will say, do not touch the patient. Analyzing. Since you are just learning the procedure, we will require you to ask 3 questions or 3 statements. 1, the one who is operating the machine should look at his knee or thighs. That is the most common body part of yours that touches the patient or the bed during an emergency. So step back and then you say clear or I'm clear. Next, ask your number 2. Number 2 is the person who is holding the mask, the back mask device. This one has oxygen. If you are going to allow this to face the victim and you say clear and your AED operator gives a shock, you might just explode because this one is giving off oxygen and the electricity will follow that and you can explode. So make sure that this part of the mask is turned away from your patient. Place it over the shoulder and then you say clear. Next, ask all the people opposite you up to the down to the feet of your victim. So everyone clear. For me to quickly see that no one is actually touching your victim, you have to raise your hands below the shoulder and then say clear. So 1 clear, 2 are you clear? It says clear. 3 everyone clear? They say clear. Give a final warning, shocking, and you press the shock button. Once you press that one, the machine will say shock delivered. You would know that it is now safe to touch your victim. You will not be electrocuted. So start chest compressions again. If your victim does not move in 2 seconds, does not breathe on his own in 2 seconds, start chest compressions. Do not waste your time checking for pulse and breathing. As soon as you see that he's not moving in 2 seconds, start CPR. Do not turn off your machine. Do not remove the patches unless a manual defibrillator is ready to use.
Apply pads as shown in the pictures.
So press the middle part.
Press pads firmly on skin. Do not touch the patient.
Stay clear.
Analyzing heart rhythm. Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear.
1 clear. 2 are you clear? It says clear.
Press the
3
button,
everyone
shock.
clear. Delivering shock in 3, 2,
Press the shock
1.
Shock delivered. Begin CPR.
1 second, 2 seconds. Start chest compressions. It has a metronome and it
10.
will count for you. Some AEDs will not count for you, so you have to count for that.
20. 30. Give 2 breaths.
Okay, so you just simply follow whatever it says. Okay? This will automatically reanalyze after 2 minutes. So do not turn off your machine. Now this is what we want you to do. Pair up. Okay, for example, these 2 students will be the pair. He will be my first rescuer and then he will be my
30.
AED
Give
operator.
2 breaths.
No pulse or breathing. Okay, start chest compressions. Power on. Always power on first. Start compressions.
The patient. If the patient is a child, press the child button. Press pads firmly on skin. Apply pads and press pads firmly on skin. Do not touch the patient.
Stay.
Analyzing
Stay
heart
away.
rhythm.
Stop CPR.
Stay.
Move to the head
Do
part.
not touch the patient. Analyzing heart rhythm. Shock advised.
Place this one over the
Do not
shoulder.
touch the patient. Everyone clear.
1. Ask me.
Press the button.
Clear. Ask me.
Are you clear?
Clear. Is shocking.
Delivering the shock.
Shock delivered.
1